Hi, my name is Dr. Brian Mailing, and I'm here today. I'm going to be answering some of your questions about stem cells and regenerative medicine. Stem cell therapy, why isn't it accepted in conventional medicine yet? Well, that's just because it's new. So anything that's new, there's a period of time where people are going to be skeptical, and it's not something that thousands and thousands of providers have experience with and hundreds of thousands of patients have had success with. So anything new, whether it's a surgical technique or a medication or whatever, doesn't right away fall into conventional medicine just because it's new. Normally we think that, for instance, with a surgical procedure, it's very site specific. You're just operating on one particular location. You wouldn't expect to see a global improvement. Same with medication. You take a pill for an infection or something like that, you wouldn't expect to have improvement in your depression or your skin condition or something else. You wouldn't expect it to work other than at the site of injury or something like that, or disease. Stem cells seem to be more of a shotgun approach, which really helps your body repair damaged or diseased tissue throughout your body. That aspect of stem cell treatments is very new in medicine. So the next question is, could stem cell therapy alone increase the height of someone? So that's an excellent question. There's lots of short people in the world who I'm sure would like to be a little bit taller. There is an FDA-approved treatment for short stature, and that's growth hormone. And if someone's parents are particularly short, it is legal in the United States to treat the adolescent patient with growth hormone to increase their height. But this needs to be done before skeletal maturity. So what's skeletal maturity? That's when your bones stop growing. So as when you're a kid, you're growing, your bones are getting longer because you have growth plates at the end of your bones where the cells are dividing and the bone is getting longer. But then it stops, okay? And then that growth plate gets ossified, which means calcified, and you stop growing, and that's when you achieve your adult height. Of course, many people want to be taller, so that would be something that would have tremendous commercial appeal if you could just give someone stem cell treatments and make them taller. But a stem cell treatment is not going to open your growth plate, and I don't think it would be as effective, certainly not as proven as growth hormone for increasing the height of an adolescent patient. It would certainly be more expensive. Can stem cell injections restore brain tissue? So we started our stem cell experience basically in Wuhan, China, at a hospital that specialized in brain surgery and neurologic conditions. Their experience included a lot of neurologically injured patients, stroke, spinal cord injury, also diseases like multiple sclerosis. So they had a lot of experience with neurologically injured or compromised patients. And they were seeing these dramatic results with cord blood stem cell treatments, basically taking the stem cells harvested from cord blood and injecting it both intrathecally and IV. My friend Eddie Amarante and I stumbled on Dr. Wu in this clinic, and we couldn't even believe it. We decided we would start bringing patients to the United States, and one of our friends had a C6 quadriplegic injury, and she was 14 years out from her injury, and she did the treatments, and she had a significant, substantial, almost immediate improvement. We thought this is incredible, so we started writing up the research. We did publish a paper on spinal cord injury, and in fact, 80% of the patients had return of bowel and bladder function, which is pretty dramatic. One of my friends that started the company with me, Eddie Amarante, had a really severe head injury. He's done a bunch of stem cell treatments, and he's had a dramatic improvement. Obviously, we're not going to just biopsy somebody's brain to see if the tissue's been restored. I suppose with some imaging techniques, we might be able to see some improvements there, but definitely we can see improvement in function. Thanks very much. I really enjoyed answering everyone's questions today. So if you have any additional questions or comments, leave it in the comments section or send me an email. Thanks very much.